Um, okay, look, welcome everyone. On behalf of the VTCTA, I welcome everyone to today's fortnightly sector update around the COVID-19 situation. Great to see we have so many members and interested parties attending today, which is great. And last fortnight's session was well attended and some great presentations by Rita and Dan. They were fantastic. And so by popular demand, we're back again. Today, the agenda is quite full. So we have, we've got Marnie O'Loughlin from Eastern Volunteers in Victoria, who's a transport manager, doing a presentation. We've got Jadie Hunter from Redcross Victoria, who's a team leader of community programs and a VTCTA committee member. And then we've got some times for some questions and answers. And I think last time the session worked quite well. We had the presentations and then we held and answered those questions at the back end. So that worked really well. If there's nothing else more to do, we might kick off. Suzanne, is there anything else you'd like me to add, or you're comfortable to kick off now?
No, good to kick off. If I could just check, there's someone who just joined on a phone number. I would just ask them to let me know who they are.
Sorry, it's Jim. Susan, can you hear me?
We can hear you, Jim. All good.
Okay, I'll mute myself now.
Fantastic, thank you. And then there's just someone else whose phone number is 0408 354 766. If you could just let me know who you are, that'd be great.
That's me, Susan. It's Jim.
Oh, is it? Oh, you've registered there twice, Jim. Okay, no problem. Thank you.
Yeah, sorry, I tried to get on the Zoom. I can actually see you all, but for some reason I can't hear you on the Zoom, so I went to phone method.
No problem. Thanks, Jim. So, all good to go, Lyndon.
Well, thanks. And look, I just want to say on behalf of the VTCTA, I just want to congratulate everyone in the transport sector across Tassie and Victoria. It's great to see so many organisations making the changes. I think that the new word now is pivot, how we're all pivoting to these new services and doing things differently, which is fantastic. And it's really clear the focus is 100% on the consumer. So I think that's an absolute credit to all the organisations and the individuals involved. So a big well done. So we'll kick off now, Marnie, if you're okay to go. So Marnie O'Loughlin, the Eastern Volunteers Transport Manager. Welcome. Marnie, still there?
Yeah, I'm here. Can you hear me?
Hi, Marnie. How are you?
I'm good. I'm good. Thank you for the opportunity to share our journey. I thought today, rather than do a presentation, I'll just take you through what we've been up to hopefully get some feedback from everyone that's here, or perhaps provoke some thoughts for others. I do want to apologise for my efforts last week for forcing everybody to watch me consume chips. I didn't realise, because I couldn't see everyone else, that you could see me. So as I was feasting away, I apologise. So I now understand Zoom. Before COVID came along, for those that don't know what we do, we provide community transport across 3 LGAs across Metro Melbourne for medical, health, social and recreational. And we also have a social support individual program where we take clients shopping physically with the client, or to social groups, or support them out in community as they need be. Obviously, with all the changes that have happened, we had to restrict that, and in doing so needed to kind of reinvent and support our client base. Knowing that we're a fairly small team, even though our outputs are quite large for our size, we knew that we had to get some additional resources, because we couldn't achieve what we wanted to just with what we had. And we knew that the sector was responding in different ways and struggling in different ways. People were closing down parts of their services because they couldn't operate under the confines that they had, and we knew that the market was, the gap for the clients were opening up. So because we're part of we've got the resource centre attached to us, we created a volunteer bank essentially to support the sector, to attract people and advertise to attract them, to see how many people we could get to then push out into other organisations and also support our own. That's been quite successful and continues to be, as more people are aware of us and more organisations are aware. So we've been able to bring people in-house for us to be able to support our shopping program, because we had to stand down some of our drivers because of their age group. Our cohort of drivers are in the age group of those that need to remain at home. So we needed some younger people in the mix to be able to help us in community too. We've been able to find volunteers to support the local Meals on Wheels program that had an increase of 5,000 meals in demands, but they had volunteer availability concerns as well. So we've been able to backfill their decline in volunteers and also beef up so they can continue to operate and meet the demand. We've provided and partnered with other organisations to give them virtual visitor volunteers. We've hooked up people with tutors to help tutor children from home when parents can't support that. We've been sourcing community support workers, people that can do websites and WordPress to work on the Kindness Ripple project. We've got volunteers that are packing kits. We've got volunteers that are packing food and hampers to go out in community or doing some community maintenance. So we've been able to feed a lot of people out in community to be able to help keep programs running where they've found some barriers. So that's been quite a positive outcome, that it's not just our consumers, it's the community that we're focused on. For us, in terms of transport, it was a bit of a quick few weeks for us that we saw it slowly shift, and all of a sudden we were thrown into what do we do. I lost about 35 drivers that I can't put on the road currently, but we've been doing a lot of things to keep them engaged while we support our clients. So we commenced doing COVID care plans, and I need to acknowledge Rita from Bridges, who was fabulous. We knew we wanted to contact clients. We knew, what we needed to create, but the how was really big. And I was able to pick up the phone and reach out to Rita, who supported me, who shared information. And I think that collaboration amongst ourselves is really important in times like this to be able to be more impactful in what we do. So thanks, Rita. It was great. We then partnered with Caledini Dementia Care. So they currently have had to shut their programs down, and they've got paid staff that they're doing background work for them, but we were able to utilise their skill set. So they're part of the team that's actually calling our clients to do the care plans. We have 18 people working on it. Half of them are the Caledini team, and half of them are some of our drivers that we want to keep re-engaging and remain connected, so when we come out of this, we can get them back on the road. But they're actually in contact and getting that social connection with our clients as well. So by the end of this week, we would have got through 1,400 clients and created care plans for them. Out of that, we've discovered quite a few things. So we're doing weekly welfare checks and fortnightly welfare checks and calling them. We're delivering shopping. We created a shopping program where we're actually taking down their shopping list, because a lot of the really vulnerable clients don't have technology and they don't necessarily have support. So they ring into our office, we take down their shopping list, a volunteer goes and shops, delivers to their front door, and we take payment over the phone by credit card once the shopping's been done. So it's contactless, it's safe for the driver, it's safe for the consumer. And we're using some of our drivers that still can operate, and people from the community to do that. So it's been a really warming process. It's getting some traction, and we're doing some marketing through the local government areas to do that. We also are stepping outside for organisations that need us that aren't in our organisation to help them to be able to access their clients. So we've got a few partnerships that are developing, and we've got some in place at the moment. We're also uncovering in talking to people that it's more than just food. We're discovering mental health issues. We're discovering things with isolation that people are struggling and don't feel they've got options to reach out. And we're just dealing with that on a case-by-case scenario, which has been very interesting, trying to find resources to help people at this time. And again, I think that's where this forum will really help us, if we can tap into each other's services. I think our partnerships, as Caledini spoke, we've also found that some of our organisations around us have had to make some pretty big decisions and reduce costs and remove their fleets and things like that. And then they're needing transport. So we've paired up with Mullen Indigenous Gathering Place, which is a food bank, and we're delivering weekly for them to get essential food items out to their client base. We're in discussion with a couple of aged care facilities as well to actually support them and some of their clients to get deliveries to them and pharmaceutical to them. And we're working with 3 different councils as part of their emergency response plan. So we're fairly active. We're finding that we're getting people reaching out to us as well, which I've diverted back to the VTCTA to connect in, who are now starting to look to people to say, well, hang on, we know that there are people operating, and how do we do it, because we just don't have the resources. So that's our journey. The shopping is increasing. We've just hit the media today with it. And got some traction in local papers. I haven't cited them yet, but I'm hearing about them. So hopefully we can then, promote that there are community transport out there that can help you with different programs. That's essentially been our journey. It's been very quick. The team have had to be very agile and all working remotely from home. That's been a bit of a challenge for us, but we've gotten through it all. And I'd be keen that if anyone's got any feedback or questions later to shoot that through.
That's great, Marnie. Fantastic, great presentation. I think that's a great example of what the sector's been up to, this diversifying to ensure that we focus on consumers and we look after the most vulnerable and we maximise our resources through this time, not only for our consumers but for all the consumers. So well done, thanks for that. And look, if we've got any questions, I think we've got the chat facility there, I think, haven't we, Suzanne, on Zoom?
That's right. Yep, that's right.
Yeah. And just, we're happy to share forms and all the things we've created too, all that kind of IP. Happy to share that, happy to share our sanitation processes and things with people, just so we can compare what we're doing and see how we can enhance our own learnings.
Yeah, that's great.
You want to leave questions to the end, Lyndon, or?
Yeah, look, I think so. I think we did that last time. That worked quite well. We just get the questions up and then we can ask them at the end, if that's okay with everybody.
Right.
Wonderful. Thanks again, Marnie. I'd like to introduce Jadie Hunter from Redcross. Jodie's going to step us through their journey as well. Thanks, Jadie, for coming on board and providing a presentation for today.
Hi, everyone. So I'd just like to start by acknowledging the traditional owners we all meet on today. I'm currently on Wurundjeri land, so I'd like to pay my respect to elders past, present and emerging. Like everybody and what Marnie just chatted about, we also had to stand down all of our volunteers over the age of 65. So we had to stand down about 95% of our workforce. And currently we are recruiting volunteers under the age of 65. We've done an analysis and we currently need about extra 80 volunteers to open up across our 31 cars across Victoria. This way we can still guarantee drives to all the hospitals within the state. We're trying to work with corporate organisations to recruit for volunteers. So we're in discussions with Football Federation Australia, Salvos, City of Melbourne and the Dunedin Transport Group. However, we've struck a little bit of a hurdle with the transport group because now that schools are open here in Victoria, the school buses are still having to run every day regardless of children are going to school or not. So we are still trying to work around how we can mitigate that. We do have a strong focus at the moment for recruiting in the Byron Southwest area, Goldfields and Northeast. We aren't able to guarantee those drives, so we have a big focus in that right now. We're currently still transporting clients who have made bookings in advance. We are utilising staff who have been stood down in our first aid and redoubt departments. These staff are doing this voluntarily. So we're averaging about 16 trips per week. Normally we average about 31, so it's a roughly half. Our Metro, Warrnambool, Mansfield services are now in a position to open up the service again and to accept new referrals. They're working with various hospitals such as Eye and Ear, Peter Mac, Mercy, Sunshine, Albury Eye and Cancer Clinics and University Hospital in Geelong. We're starting to prepare for an increase of volume now that elective surgery is back on happening in Victoria. We have noticed a high volume of cancellations with clients due to their appointments now being moved in towards telehealth. So we're just seeing to see what happens out of that. Welfare calls are being conducted to both clients and volunteers the day before their trip, just to ensure that they're both feeling well enough to travel with us. My next one is about PPE supplies. So all of our cars have masks, hand sanitizer. However, we have noticed there's a shortage of wipes and gloves. We're being creative with the wipes and supplied all of our cars with spray bottles and asked drivers to use soap and water. We have been advised that that is just as effective. A little tip, I have been told by my local supermarket that as a community worker, we can go in community hour, show our business cards if you've got them, and that may help us to get some wipes in all of our vehicles if you need. We're trying to reduce we're trying to mitigate the risk of no longer using drivers for 2 consecutive days. We're ensuring that drivers have a day in between drives. Each week, we've got one staff member going to the office to focus on distributing PPE supplies. And we're having to ration that because there is such a shortage. I'm not sure if anyone else is noticing that, but we are at Redcross. With all of our PPE supplies, we've got to distribute it nationally for various other departments across the country. We are, however, in Victoria exploring the use of P3 masks for drivers who are volunteering 2 to 3 times a week. We've been informed that P3 masks last longer than P2. It just means that the P3 mask can be used up to 2 to 3 weeks, I believe, as opposed to a P2 mask having to change for a few hours. The P3 masks, though, are $95 each. With all of our drivers that got stood down, we are providing them with regular updates as to what is happening in the program as well as the organisation. We did ask all of our patient transport drivers if they would be interested in assisting with food deliveries. Received an interest of 50+ drivers who were interested. We did an assessment to determine that anyone over 65 can still do food deliveries as there's no human contact required. It's literally just dropping it off at their front door. Our Victorian Community Mobilisation team are engaging with all Redcross volunteers, conducting surveys on how they are they safe, and how Redcross can support them. Communication has been sent to all of our volunteers on wellbeing tips, encouraging to connect with their local community. And we're also exploring new platforms to connect with our volunteers. This is just a bit of a general Red Cross response to COVID-19. It is probably a little bit more Victorian focused, but we've partnered with Food Bank to deliver food and hygiene packages. A couple of weeks ago, in one weekend, we delivered 9.6 tonnes of food, and this was done by both volunteers and staff across the state. We are delivering telephone outreach, and with those who are impacted by COVID-19, we're averaging about 400 calls per month, with this increasing, and volunteers have the accessibility to do this from home. Our community visitor scheme program is now online to continue social engagement in nursing homes. Our community mobilisation team is also piloting a ISO fun pack for those in hotel isolation. This includes things like moving, exercising, mindfulness, creativity, and connecting to people whilst in isolation. I believe this is being launched in Sydney this week. Last week, we released our bushfire report for the last 3 months, January to April, so we still are actively involved in that. So Red Cross has assisted 27,500 people who have been impacted by bushfires. 68 million grants have been given to 3,524 people. 70 million has gone towards the rebuilding program. And there's more involved in this report, and I'm happy to send this to Suzanne so it can be distributed to all of you if you want to find out what has been happening in that space. We've had some challenges over the last few weeks. So I'm not sure if this is a common theme, but we've had a number of volunteers disgruntled about being stood down due to being over the age of 65. I'd love to hear if anyone else has experienced that. We've also had staff resisting the new ways of working. It's such a fluid environment, and a lot of our staff are being set in the ways. We're now working from home. And just doing a new way of working and being across everything. So we've got 31 cars in the state. Another challenge is technology. It just some days does not work. We're also trying to connect with staff on a daily basis because they are working from home and we aren't having that interaction as we generally would have. So we're having one-on-one calls each day in the morning and team updates in the afternoon. And once a month, our department community programs is trying to do a monthly catch-up drinks. Challenges with staff who have to homeschool. We've supported them by letting them know that we're all on hand to answer questions. In my team, each staff member's got a delegated topic like geography or history, mathematics. So if a staff member has a question, they know who they can go to try and get the response. So we're just trying to make sure we're supporting our staff as well as our volunteers. Having elective surgery now about to open up in Victoria as of next week, we have all the drivers ready, but we're not necessarily getting the referrals. So that is a little bit of a challenge, is trying to keep these volunteers engaged, especially the new ones, because we don't necessarily have the clients. So there's some of the challenges that we've been having. We've had some successes as well. A number of departments are working to ensure patient transport can remain open and fully back up to capacity. We are utilising our patient transport drivers across various departments, such as bushfire recovery and doing telephone outreach. We've had a success where we've still been able to utilise student interns with us. And this is bringing a fresh new energy to the team. Our success is that we haven't had to cancel any clients because we have been able to guarantee drives. However, we're noticing a higher volume of cancellations being cancelled by clients due to the telehealth. We've got successes with new ways of volunteering recruitment and training, changing processes and reducing the time challenges for on-board volunteering. So we've now got our training package all available online. Previously, this was delivered by staff and it was dependent on staff capacity as well because they covered the whole state. And the success is the organisation's conducting a wellbeing session every day for staff. So we're also trying to support staff as well as our volunteers in this time. I have noticed a few questions pop up in terms about PPE for clients. We also have enough masks in our cars so that clients and volunteers must wear masks while travelling in the vehicle. So we do have that as a policy. But other than that, that's all from us in Victoria.
That's wonderful, Jodie. Thanks very much for that update. It's great to hear what's happening specifically with transport, but also to what Redcross is doing more broadly. I think that's wonderful. So congratulations to you and to Redcross. And I know in Tassie as well, Barbara Hill and her team are doing a great job across the state of Tassie as well. So well done to you guys. Fantastic.
Thank you.
Thank you. Yes, great. We've got questions, and we've got a question here from Teresa. It's to everyone. How are the volunteer callers dealing with the mental health issues that are coming up during the conversation? So that was a question to everybody in particular. I'm not sure if someone would like to answer. Is that something, Maddie, you're able to answer?
Yeah, I can have.
And I'm happy to answer it too from a Redcross perspective.
Fantastic.
Okay. From Eastern Volunteers' perspective, we have a system where they contact us directly. If it's Caledonian staff, they go via Caledonian to debrief, and then I have a conversation with the CEO, Sarah, that's there. If it's my team, they come through to me. We have a conversation about it. We have EAP if we need to refer to that. Quite often the debrief appears at this stage to be enough, and then we follow up, we loop it back with the person that's made contact to let them know that we have followed up. They might not necessarily get full detail, but enough to satisfy that that person is as safe as they can be, while we put other resources in place for them. But we've got the EAP support program.
And if I might just add to that too, Teresa, down in Tassie, the Department of Health and Human Services, that you'd be aware they've got the EAP, the Employee Assistance Program, which I think is part of the DHS HAC contract. So providers of that service in Tassie are able to access that free of charge as well. Jadie, would you like to add to that?
Sure. So with every update that we provide our volunteers, we also include the EAP number. So even though they know it's available, but we're just promptly reminding them each time that they do have access to it. In terms of the mental health with our telephone outreach, all of our volunteers who are providing outreach calls do have psychological first aid training. They cannot do calls until they've completed that training, so that we've covered both clients as well as volunteers in that respect.
Right, wonderful. Well, hopefully, Teresa, that answers the question to some degree. And of course, if you've got any more questions after today, you can send them through to Suzanne. And as what Suzanne will typically do there is distribute that question out among the membership to help answer any other questions that pop up. And also, too, of course, it helps inform future agendas for this group as well. So encourage questions and really encourage the questions, not only just now, but outside this meeting as well. Thank you all. This Marnie as well. More about the COVID-19 care plans, and that comes from Taylor in Tassie, the wonderful Mersey Community Care on the Northwest Coast.
Yep. Okay. So with our care plans, and this is where Rita was fabulous. We've got a series of questions we ask them to make sure that they do actually have a plan to access essential needs. So, our questioning is very much around, do they have access to food? Do they have access to medication? And if they've got understanding their family supports or their network, and if someone in that network was removed for any reason, due to contracting COVID or just being locked down, whatever it may be, that they have another plan in place. And it's been quite an interesting exercise, because we find at that point they've not. Some of them have their first part sorted, but aren't planning for if something changes. So we use the standard template that we use for our care plans, which I'm happy to send through to update. So this one's purely just like an overlay. We've approached it as an overlay care plan, separate to the normal process of transport care plans till we get through this period.
Great, wonderful. Thank you for that, Marnie. Question here is around the protective, the PPE. I know we have answered that to some degree, and I think I might just start off answering that question and go to others to also fill it in. I guess, Jim, what my take on this is that we're seeing right across the country is a range of different methods being applied, and it comes down to, I think, organisations, one, looking at what the federal advice is and the local advice, and then also overlaying that with their organisation's own risk assessment and on their own journey and their own procedure dealing with that. So there are if you've got the equipment, some people are choosing to use it, some people are ordering the equipment, and some providers I know are just following what is the federal government advice, and that is those that are suspected of COVID-19 infection or confirmed COVID-19 infection. Actually, it is mandatory that you do use it. But again, organisations are applying their own risk management over top of that, which is fantastic as well. I'm not sure if, Marnie, you want to add something to that, or Jodie, you want to add something else, but feel free if you would like to.
Yeah, I think for us, we're sanitising cleaning cars each morning and night, and in between clients, I think everyone's doing. We have drivers with masks in the car, and they've got the instruction if the client's showing any sort of symptoms of, you know, not feeling so well, that they're instructed to give them a mask. There's sanitisers in the car for the clients and for the drivers. We had gloves in there, but we've actually removed them because there seems to be a fair bit of conflicting information in terms of what's good and what's not, and the availability that we've opted that the sanitizer, constant use of the sanitizer and washing your hands poses less risk than having gloves in contact constantly with the internal environment of the car. That's where we're at, but I'd be keen to see where our people have that weren't in the last forum have landed in terms of car sanitation.
Yep.
I'm going to follow on from that. We provided our volunteers just a PDF document on how to clean the car, what areas to focus on, such as the steering wheel, seat belts, where you put the seat belt in, the door handles, the handbrakes and all of that sort of stuff. So that's gone out to all of our volunteers, and we advise them to clean it after every day. We are making our clients wear masks just as a prevention, but we are finding wipes and gloves are just not available across the country. They're just becoming very hard to find. But soap and water can help clean a car effectively, and we were advised that that was something we can do. So all of our cars have spray bottles in them so that it's easy to clean them down. Yeah.
Great, thank you. Looking at the questions here now, I think these masks, I think we've discussed that. Based on vulnerable group, yeah. So there's a conversation there from Marnie that's probably directed at Jadie. You might be able to deal with that, or maybe offline. Question from Evelyn, which is curious to know why volunteers over the age of 65 are asked to stand as opposed to 70. And I think that's probably similar to the PPE advice. I mean, again, federal national cabinet is saying that if you're 70, then it's essentially mandatory. Then if you're 65 and have multiple health issues, then you fall into that 70 above. Again, organisations are making their own decisions on this. Again, there is national cabinet advice, and then there are organisations that are making decisions on that as well. So my advice would be, minimum is to understand what's happening from the national cabinet and your state health authorities, and then as organisations will have their own risk management over top of that. Any other comments on that, Jodie or Marnie?
No, it's just a wait and see game half the time.
Indeed. We've got a thank you there from Taylor. That's good. Questions, Marnie? What arrangements do you have? A question from Suzanne to Marnie. Okay. What arrangements do you have with Caledonia, and how is it negotiated?
Okay, so we have a memo of understanding, an MOU that we've developed. So the arrangement is that Sarah has given us complete access. So we share a bank. There's 8 staff members from there. So there's a roster that goes out every week. Sarah might need them for 1 or 2 of them to do some stuff for them, and the rest of that is then allocated to us at the start. And now we just funnel the work back and forward, and there is no expectation. Sarah's very focused on both obviously the community helping us and the welfare of her team. That's come across that they're still engaging in something else, in meaningful work that they're used to doing, and still having that client contact and engagement. So it's just an MOU where there's just a lot of flexibility from both sides to be able to operate together. And as we come out of this, that will change essentially. Yeah.
Wonderful. Thank you. A question there from Jim. Marnie, how are you cleaning your cars between clients?
Yep. So between clients, we have the same setup. We have sorry, you might have just lost me for a sec. Between each client. So over morning and night, the cars are completely done, gone through. And then between each client, they have to do the door handles, the seats, where the client's been sitting, the steering wheel, the whole lot. We have masks in the cars. We have sanitizer in the cars as well.
Wonderful. Great. Thank you. A couple of questions here for Jadie. Can you share the car cleaning guide? Is that possible? And I think that's been asked twice. So I'll leave. Look, what we might do after this, Suzanne, if you could, which you normally would do anyway, summarise those questions and any requests might be able to follow up directly with those who have been requested of and distribute those across the membership. Is that okay?
Yes, all good.
Great. Okay, where are we now? That's good. Happy. Oops, I just pressed the wrong button. I think that may be all the questions at this stage. Look, we've got a few moments, so if anyone's got any questions, please just tap them through. And I think what we've got here is a good range of questions too that might inform some future speakers and agenda items for the following sessions, which is great. But I guess here's a good time now. If there's anything that we're not discussing that should be discussed or you'd like to be discussed, please send that through too on the chat. That can help inform future agendas also. Additional to that, you can also email Suzanne directly as well.
Yep. So I wonder, Lyndon, if we could maybe ask if there's anyone people would particularly like to hear from, either other member organisations or other peak bodies.
Yep.
So I don't know if everyone's seen today, VCOS has announced there's another sector update occurring shortly. And they've also developed a COVID digital forum. Sorry, so the digital forum is happening on the 29th, so next Wednesday. And they have a sector and government COVID-19 response group was formed last week, I think, as well.
Great.
Yep. Can I just put a broad question out to the group, and maybe it's not to be answered now, but in terms of insurance, one of the things that I was talking to with another transport organisation that want to start back up again, and we were throwing around the idea that we've all got public liability and all these insurances, but if a case actually was traced back to being a part of the someone's transport program, what are the legalities around that? You know, if we've got good process in place, but has anyone made any traction in having a look at the liability and how to reduce that risk?
Look, obviously I'd encourage everyone to get their own legal advice on a question such as that. So I'll underline that and bold that comment to make that very, very clear. I think though, if you are, as an organisation, and taking advice from sources, and then you're applying your own management and risk assessments over top of that, then that's a very good place to be. Okay. Yeah. Again, I would encourage everyone to get their own legal advice, but I think from our organisation, that's the approach that we're taking. Get the correct information, get the right information, and as a minimum, and then apply that and anything you think you need to do over top of that to your own organisation, your own particular environment, and individual, services. I think there's not much more you can do than that.
Mm-hmm. Okay.
I guess if you're doing that, your risk would somewhat reduce.
Yeah. Thank you.
But definitely get your own legal advice. I'm not a lawyer. Yeah. Okay. What have we got there? So we've got, so everyone's still providing services. Yes, we're getting, I think what's happening, Jim, across the country, we're seeing that organisations are providing essential transport and following that advice from state and federal public health authorities. So that's still good. Yeah. Okay. Well, look. Any other questions? No. Just give it another minute or so, just to, if you've got something you'd like to ask, whether it be a question for anyone here, another member, one of the speakers, anyone at the meeting, or like to inform future agendas. Now's a good chance to send that through on the chat function.
Lyndon, I'd like to ask if any organisations are developing further partnerships with councils at all, or what are they having clients come to them who are no longer receiving service that client was previously providing? People can just unmute themselves if they'd like to respond verbally.
Hi, I'm Heidi from Link. So we've found that a number of the local councils have actually diverted their staff to other services. So they're looking after many of them, their clients themselves, around essential support.
Okay. Yep. Thanks, Heidi.
Yeah. From City of Stonehill's point of view, that's exactly right. Is we're looking at where we've had to not do social shopping or group shopping and services, is we've referred them into our in-home support services and developed the care plans and handed them over, so they get individual one-on-one support from that perspective. And we would expect that as we go back to normal, that it'd be a gradual process that they would come back onto the service. So no client, all clients took up that opportunity unless they were self-isolating themselves.
Wonderful. Thank you.
There's a question down there from for Barb. Oh,
Oh, it's from me. Oh, what do you know?
You can read your own question out there.
Well, I'd just test all this out. Very good. So there's a question there from myself to Barb, and look, that's probably more of a broad Meals on Wheels question. We know that Meals on Wheels are doing a fantastic job because that service has significantly increased in demand, and that's I guess it'd be interesting to hear from Barb how that's going. That can, whether in resources, any other providers in Tassie can particularly help, and I'm sure that applies across Victoria as well. Just curious, yeah. And we're all aware too that, of course, if we do come across consumers in our welfare calls or our engagement with them, that if they're unable to order meals, so they can't click them, and if you, as a provider, you can't organise that click, that there is the opportunity to refer them back to My Aged Care, and there is a relief pack or an emergency pack that can be provided. So just remind everyone about that as well, to refer back to MAC if that happens.
So they can also refer them directly to Meals on Wheels as well. So we can take direct referrals and we'll put them back through My Aged Care if they need it urgently.
Yeah, thanks, Barb. Yep, forgot that part. How's it going, Barb? You guys are going okay? I mean, you guys are doing a fantastic job in Tassie, so going okay?
Yeah, this week it's going okay. So we obviously look after the Northwest Coast, and the hospital got closed, and we had 24 hours to find a new supplier of meals and readjust our meal delivery, which we did in 24 hours, so nobody went without meals. So we've got a frozen delivery in place at the moment while the hospital's closed. So that's probably been our biggest challenge recently. But yeah, we've obviously seen numbers increase for Meals on Wheels, which is good, and we're able to meet that demand. So again, and I think Meals on Wheels Association are the same in Tassie. If there is anyone out there, and I'm sure Victoria would be the same, that you need to refer to meals, please do.
Right. That's wonderful. Thanks for the update, Barb. Look, just while we're on that too, specifically for Tasmania, and I'm not sure if it applies across into Victoria as well, but Hobart City Mission, I think that's the same for Launceston and the Salvation Army on the Northwest Coast, that have an oversupply of frozen meals from restaurants around the state that have been providing them to Mission to give out to those in need. Now, the demand for those meals, I understand, over the last couple of weeks has dropped, so there are a high volume of frozen meals available to as emergency packs. But again, I think there's other options such as Meals on Wheels and others now that are out there as well. But I just thought I'd throw that out there. And the best way to contact Hobart City Mission would be to go through TASCOS and ask for Charlie. Okay. Right, any more questions? Let me have a look. We've got... No. Okay. Oh, look, I'm sure we're all busy. We've got lots to do. So if there's no more questions, we may call that a session.
Lyndon, may I ask a question that's not related to COVID?
Absolutely.
Sorry, I feel like I've been pumping lots of questions out.
Quite refreshing, actually. Go for it.
No, we're just reviewing all our documentation here, and I guess one of the things that I'd be interested in, if anyone was happy to share, is their home care package agreements that they have with clients, the templates for that. Just reviewing everything and just making sure they've got everything covered. So I do feel like I'm a bit on the scrounge today, but appreciate the forum for it.
Right. Well, that's okay. I think that's been picked up in the comments, and I think that's something that Suzanne can again put that out to members, and those that are happy to share, we'll share them through. So no problems at all. Yep. Great. And I think also too, by all means on the website, we've got the other members' details. I'm pretty sure, Susan, that's right, on the website we've got members. So by all means use this medium, Heidi, by all means. But again, feel free to reach out to anyone. Yeah. Great. Wonderful.
Just Lyndon, my other comment would be people are really keen to have the COVID-19 document back, but I haven't received a great number of them. So I'll approach people directly again, but if you have documents, policy, you have a COVID-19 policy or any communication documents that, or procedural documents that you're happy to send through. I think people think they're already, they already exist, but it would be really, people are really keen to still see those, just to have a look through as well to see if they've missed anything or that kind of thing. So if people could please send them through to me, that would be really great.
Right, yeah. And maybe we can chat at some stage, Susan, we could maybe even put a list together of what's a good suite of documents, and we can feel that might be a way to just ask out for this policy or this procedure. Might be a way of feeling it. Yeah, great.
That sounds good.
Yeah. Okay, look, I think we're comfortable. It's 11:21. We've provided a fair bit of time. If someone's got a burning question and for some reason hasn't come through on the chat, you've got probably 20 seconds to scream it out across the Zoom. Otherwise, we'll finish up. So I'll give everyone another 10, 15 seconds, given that we are inside the time. Okay, look, I think we'll call that a session. Look, on behalf of the VICTAS Community Transport Association, thanks to all the speakers today for presenting so well. And we've had 2 really good sessions now, very, very good presentations that have been, I know I've got a lot out of it, and I'm sure others have as well. So I really appreciate you all for that. Thanks for all the questions and participating in the session. It's very, very worthwhile. And for Suzanne for facilitating. Look forward to the next one, which will be in a fortnight. Encourage any questions to keep coming after this forum through to Suzanne directly to inform future agendas. That would be much appreciated. Okay, Suzanne, are you happy with that?
Yes, absolutely. And we've already got a couple of speakers lined up for next time, but if anyone is really keen to, please just get in touch and we'll book that in.
Great, wonderful. Okay, thanks all. Stay safe.
Thanks, everyone. Bye.
Thanks so much.